Welcome to our channel. I'm a board-certified pain physician. I also practice integrative medicine in Jefferson City, Missouri. This is my wife.
Hi, I'm Dr. Jefferson City. I practice conventional gynecology and integrative medicine. Welcome back to our channel. If you've never joined us before, we'd love if you subscribed. We're integrative physicians that want you to be healthy so that your body can heal itself, involving your other doctors as well. So every week we upload 2 videos a week. Please subscribe and also hit this notification bell so you know when we've uploaded our next video. And give this video a thumbs up. We appreciate it. Today we're going to talk about Hashimoto's thyroiditis, which is...
It's just low thyroid.
So you're just making a low amount of thyroid from your thyroid gland, which sits right here. The whole video is just going to be a really helpful video if you have Hashimoto's thyroiditis, or if you don't know if you have it, how you can test for it. But basically, we're integrative physicians that want you to optimize your body so that you can help your endocrinologist or primary care doctor treat your Hashimoto's thyroiditis. We're going to do that with diet, lifestyle, and exercise, and what type of exercise.
Give you a little introduction, because I'm always fascinated with medical history. Hashimoto was a Japanese physician who discovered and described Hashimoto's in 1912. Actually, he noticed that some of his patients had enlarged and very tender thyroids, and they went on to find out that our body's actually making antibodies to it. It's kind of defeating itself in many ways. And it's the most common cause of hypothyroidism in the Western civilization, especially regions that really have high adequate amounts of iodine. Now, there's some regions in the world that have low amounts of iodine. That's the most common cause, but low thyroid function in our society is most commonly caused by Hashimoto's.
What this whole list indicates is the thyroid runs everything in our body, so it's really important to notice if things are not working well. For our bodies to really work well, it needs to be at a certain body temperature, and that leads us into one of the things we wanted to tell you, which is a really cool home test that you can do yourself. Now, it's obviously not diagnostic for thyroid disease, but you can test it out yourself at home. Get yourself one of those old-fashioned mercury thermometers. So they're the type that look clear and they're in glass, and the mercury is a mercury color. It's kind of like a really pretty silver, and you have to shake it down, and you shake it down to below 96 degrees on the actual lines. Once you do that, then you just check your temperature 3 days in a row, right when you wake up in the morning. So the way you do it is you put it in your armpit, you wait 10 minutes, and then you look at it. And if the temperature is less than 97.8, that could indicate that you have low functioning thyroid. And if you're a menstruating woman or you're on your period, you want to take the temperature during your period.
It has to use a mercury thermometer?
It has to be a mercury thermometer. So if you've tested your body temperature and it's less than 97.8 degrees Fahrenheit 3 consecutive days in a row, go to your doctor and just ask them to run thyroid blood tests. They're going to draw blood, and it's always just one poke. Usually it's 4 different tests, and one of them is called a TSH. The other one is a free T4. The other one is a free T3. They might draw a reverse T3, and also thyroid antibodies. And when you have Hashimoto's thyroiditis, the antibodies are always elevated.
So let's say your physician's diagnosed you with hypothyroidism, and you're actually on medication, which we recommend that you do take. We do not recommend you substituting integrative therapies for conventional medicine, because conventional medicine has very good treatments for this problem. But if you use some of the integrative strategies, you can actually lower some of the medication requirements and actually enhance your health. Number one is remove any type of stressors that you have in this, not just psychological, but they include nutritional, environmental as well. Because if you already have a depleted immune system, actually this is not good for your system, which already has antibodies floating around attacking your own thyroid. So it's very important that you address all of these areas. And there's certain even gluten sensitivities or even other food sensitivities that actually add to this problem. Certain exposure to heavy metals, especially those individuals who work in environments where you've got high amounts of chlorine, perchlorate, fluoride, and bromine. So these things you have to be aware of, and most of the times if you're in an environment where that exists, then you should know about it and you should actually be on the alert, especially if you've had any type of hypothyroid symptoms. The other thing that you should be aware of is that there are certain nutritional things and supplements that you can try that'll help not only keep the amount of your existing thyroid hormones up as high as they can be, but also help in terms of how they work and how they get converted in your system to its active thyroid form. And they include vitamin D, zinc, iron, and selenium. These are all things that actually are very beneficial for you. Other things too is that you, in terms of nutrition, is think about also instituting an anti-inflammatory diet. We mentioned this a lot in a lot of our other videos. If you've already, anything you can do to decrease the amount of inflammation in your body, this will also help your immune system. Unfortunately, when I tried to look up the data and the research on this, I could not find any clear-cut positive correlation between instituting an anti-inflammatory diet and decreasing the incidence of Hashimoto's. Although, if you look at it from a perspective of it can help your optimal health, anything is better for you. The other thing to remember too is there's some foods that are actually not good for you, if you're especially used in high doses, and these are known as the brassica vegetables, and they include bok choy, cabbage, turnips, peaches, and Brussels sprouts, among others. And if you take a lot of these, you may want to cut back. Doesn't mean you can't eat them, but you may want to cut back because they do affect the ability of proper functioning and production of your thyroid hormone. The last thing really is another common thing we talk about in some other of our videos is exercise, and we really should be following a heart-healthy diet as much as possible, because the last thing you want to do is have hypothyroid disease affecting your heart health. And one of the most common things that people use is aerobic exercise, which is very effective. And it's very important for people with hypothyroidism to have a good exercise program, not just for the perspective of helping you maintain ideal body weight, because this hypothyroidism does result in weight gain, but also helps with mood elevation. And it also, exercise has been shown to actually help in some of the effectiveness of the T3, which is one of the thyroid hormones we have in our body, and on the cells itself.
What's so cool about exercise is that there's a study studying yoga in patients with hypothyroidism. They studied 2 moves. They had these subjects in the study do these 2 moves along with their asanas, along with their savasanas. These 2 poses in particular were found to increase the amount of thyroid hormone production in their thyroid gland. Now, more studies, they say, need to be done to see if there's a positive correlation directly between these yoga moves or not, but it doesn't hurt to do them unless you have problems with your spine, or if you're pregnant, then you're not supposed to do these, so do the advice of your yoga teacher. So we're going to put the picture right here, and Jack put his picture on this lady, and then here's another one.
It was hard. The last thing I want to mention too is that make sure that you have periodic monitoring. I've had a lot of my patients come in that I know they're on thyroid medication, the same dose that they've had for 2 years, and I've asked, when's the last time you had it checked? Well, I haven't been to my doctor in about a year. And it's like, well, you really should have this monitored, because if you find that you can actually lower some of the requirements of it, that's actually better for you. Well, that's it for today. Next week, we're going to be talking about hyperthyroidism. That means too much thyroid hormone in the system. And this week's check-in is going to be on good sources of supplements and vitamins.
So stay tuned and mark your calendars for the upcoming Healthy You. It's our first annual conference involving local physicians, especially Dr. Christopher Link, and it's going to be held at the Capitol Ritz Banquet and Dance Center on Saturday, October the 19th. You can get the early bird special.
I want to mention too that the net proceeds will go to St. Mary's Hospital and Capital Region Hospital's Foundation.
We thank them very much. And we look forward to seeing you in our next video.
Bye-bye.
This is the lean times.
This is the lean times. It's not lean times. You gotta have a balanced times.
Come on.
It's always. I like more understated humor. But
No, it's not funny. They studied in this study with people
Start
with.
over again. They studied in this study. Oh no, it just sounds funny.
I talk like that. Your finger do like that.